Hi, I am Dr. Ayman Salah, Specialist of Clinical Pathology, Ministry of Health in Egypt. We are going to talk today about types of anemia. We will use the flipped classroom technique. By the end of this classroom, we hope each student achieves the following objectives: discuss the methods of classification of anemia, determine the causes of anemia, and describe how to investigate a case of anemia. Let's see the pre-work assignment that was sent to you. It was a video about types of anemia. Let's take this poll using the audience response system. What is the most common type of anemia? Yes, the correct answer is iron deficiency anemia. This is a case scenario about a 64 years old vegetarian woman presented to the clinic with muscle weakness, loss of appetite, and fatigue of 4 months duration. She also had some neurological symptoms. On examination, she had pallor and her heart rate was increased. It was 114 per minute. A full blood picture was done to her, and this was the result. As you see, she had marked anemia. Her MCV is increased, indicating a macrocytic anemia. She also had leukopenia and thrombocytopenia. Now, we are going to start small group discussion. You will be divided into small groups of 5 students. Each group will perform the following tasks: correlate symptoms with the CBC, give a provisional diagnosis, and what are the further investigations needed to reach a final diagnosis and a plan to manage this case. Now we will return to the large group. We need a representative of each small group to discuss what was agreed upon in the small group. Let's talk about anemia. Anemia is diagnosed when hemoglobin level is less than 13 gram per deciliter in males and less than 12 gram per deciliter in females. To classify anemia, it may be classified according to etiology. It may be due to decreased production or increased destruction of RBCs, or a defect in the function of hemoglobin or blood loss. It also may be classified according to RBC's morphology. It may be a normocytic normochromic anemia, or microcytic hypochromic anemia, or macrocytic anemia. First, we do a complete blood picture and notice the RBC's indices, the mean corpuscular volume and mean corpuscular hemoglobin. The first type is normocytic normochromic anemia, where MCV and MCH are normal. It may be due to anemia of chronic diseases, or organ failure, or acute blood loss. And this is a picture of normocytic normochromic RBCs. The second type is microcytic hypochromic anemia. It may be due to iron deficiency anemia, thalassemia, sideroblastic anemia, or lead poisoning. And this is a picture of microcytic hypochromic RBCs. The last type is macrocytic anemia. It may be amegaloblastic anemia or non-megaloblastic anemia. The megaloblastic anemia may be due to vitamin B12 deficiency or folic acid deficiency. I think the case we discussed about the vegetarian woman was amegaloblastic anemia due to vitamin B12 deficiency. And this is a picture of macrocytic RBCs. To summarize, we can use the RBC's indices MCV and MCH to classify anemia to reach a final diagnosis for the cause of anemia. When you go home, please visit this link to know more about how to evaluate and investigate each type of anemia. Any questions? Now, in 5 minutes, we are going to take this quiz. Please answer these 3 questions. And these are the correct answers. Please do this evaluation survey We need to know your feedback about this session. Thank you very much.